Welcome to Wellness IQ by sbmemorial.com, your trusted source for health information. The liver is a vital organ. It has many jobs. It filters toxins from your blood. It helps with digestion. It even fights off infections. When the liver is damaged and can't function properly, a liver transplant might be the only option. Liver transplantation is a complex surgery. It involves replacing a diseased liver with a healthy one from a donor. This life-saving procedure has transformed the lives of many patients with end-stage liver disease. In the United States, over 8,000 liver transplants are performed each year. This number highlights the growing need for organ donation and the importance of raising awareness about liver disease. This comprehensive guide will delve into the intricacies of liver transplantation. We'll explore the conditions that necessitate it, the different types of transplants available, and what to expect before, during, and after the surgery. A liver transplant becomes necessary when the liver suffers severe damage and can no longer perform its essential functions. Several conditions can lead to liver failure, including cirrhosis, which is the scarring of the liver often caused by chronic hepatitis C or alcohol abuse. Hepatitis B or C are viral infections that can lead to chronic liver inflammation and damage. Non-alcoholic fatty liver disease, or NAFLD, involves fat accumulation in the liver, often linked to obesity and diabetes. Acute liver failure is sudden and severe liver damage often caused by drug overdoses or toxins. When these conditions progress to end-stage liver disease, a transplant becomes the only viable treatment option. Symptoms of liver failure can vary but may include jaundice, fatigue, abdominal swelling, loss of appetite, nausea and vomiting, and easy bruising or bleeding. If you experience any of these symptoms, it's crucial to seek immediate medical attention. Early diagnosis and treatment can significantly improve outcomes for those with liver disease. Liver transplantation relies on the generosity of organ donors. There are two types of liver donors: living donors and deceased donors. Living donors are individuals who donate a portion of their liver to a recipient. The liver has the remarkable ability to regenerate, and both the donors' and recipients' livers will regrow to their full size after surgery. To be a living liver donor, you must meet specific criteria: be in good overall health, have a compatible blood type and body size with the recipient, and undergo extensive medical and psychological evaluations. Deceased donors are individuals who have died and whose families have generously chosen to donate their organs. These donors can provide either a whole liver or a portion of their liver for transplantation. Organ donation is a selfless act that saves lives. By registering to be an organ donor, you can make a profound difference in the lives of those awaiting a transplant. Section 4. Types of liver transplants. Finding the right fit. There are two primary types of liver transplants: orthotopic liver transplantation. This is the most common type, where the diseased liver is entirely removed and replaced with a whole liver from a deceased donor, and living donor liver transplantation, or LDLT. In LDLT, a portion of a living donor's liver is transplanted into the recipient. This option offers an alternative when a deceased donor liver is unavailable. The choice between orthotopic and living donor transplantation depends on several factors, including the recipient's medical condition, the availability of donors, and the surgical team's expertise. In recent years, advances in surgical techniques and immunosuppressive medications have significantly improved the outcomes of liver transplantation, offering hope to countless individuals with end-stage liver disease. Section 5. Life after a liver transplant. What to expect. After a liver transplant, both the recipient and the living donor will undergo a period of recovery and adjustment. Recipients can expect to spend several days in the intensive care unit, or ICU, followed by a week or more in the hospital. During this time, the medical team will closely monitor their condition, manage pain and medications, and provide support and education. Living donors typically experience a shorter hospital stay, usually around a week. They will receive pain management and close monitoring to ensure their liver regenerates properly. Both recipients and living donors will need to make lifestyle changes to maintain their health and prevent complications. These changes may include taking immunosuppressant medications for life to prevent organ rejection, adopting a healthy diet and exercise regimen, and attending regular follow-up appointments with their transplant team. Section 6. Medications and follow-up care. The road to recovery. Immunosuppressant medications are crucial for preventing organ rejection after a liver transplant. These medications suppress the immune system to prevent it from attacking the transplanted liver, which it recognizes as foreign. Recipients will need to take a combination of immunosuppressants for the rest of their lives. The dosage and types of medications may change over time based on their individual needs and response. Regular follow-up appointments with the transplant team are essential for monitoring the recipient's health and managing any potential complications. These appointments may include blood tests to check liver function and medication levels, imaging scans to monitor the transplanted liver, and biopsies to assess for signs of rejection. Living donors will also require regular follow-up care, although they will not need immunosuppressant medications. Their medical team will monitor their liver function and overall health to ensure their recovery progresses smoothly. Section 7. Living a healthy life post-transplant. Tips for recipients. Life after a liver transplant can be fulfilling and healthy with proper care and attention. Here are some tips for recipients to maintain their well-being. Adhere to your medication regimen. Take your immunosuppressants as prescribed and report any side effects to your doctor promptly. Embrace a healthy lifestyle, eat a balanced diet, engage in regular exercise, and avoid alcohol and smoking. Prioritize follow-up care. Attend all scheduled appointments with your transplant team and communicate any concerns or changes in your health. Be mindful of infection risks. Your immune system will be suppressed, so take precautions to avoid exposure to germs, such as washing your hands frequently and avoiding close contact with sick individuals. Remember that you are not alone on this journey. Your transplant team, support system, and fellow recipients are invaluable resources for guidance, encouragement, and shared experiences. For all health-related queries, visit sbmemorial.com.